Well, thank you everyone for joining our science seminar today. I have the wonderful pleasure of introducing Dr. Aki Nakata, who is presenting from Japan at the bright early time of 4 a.m. his time. He is a professor of occupational epidemiology at the International University of Health and Welfare, where he has been since 2018. He's currently the dean of the School of Psychology and Healthcare Management, as well as the head of the Department of Epidemiology and Social Medicine. He earned his Ph.D. in public health from the University of Tokyo in 1997. And after receiving his Ph.D., he started his career as an occupational health scientist at Japan NIOSH and later at US NIOSH, where he was a team leader of the Work Organization and Stress Research Team until 2012. So in 2012, he
What kind of
became a full
volumes? I mean, I
professor.
just glanced at them, but they're not going to do anything for the podcast.
I'm sorry.
It's more unless there's one that's really big, but I'll look just to make sure. But was there any?
I think there was one.
Aaron, can you please
I
mute
tried to
yourself?
put this bigger one aside, so that's where it's like there's one in the box.
Hi, Ryan. I muted Aaron. Also, you're unmuted. Yes.
All right. Sorry for the pause, everyone. I think I will just finish by emphasizing Dr. Nakata's research interests, which are occupational sleep epidemiology, psychosocial job stress and immunity, workplace interventions, as well as the effects of various lifestyle factors on health and safety. So with that, I'd love to turn over the time to Aki for his presentation. Thank you.
Thank you, Dr. Ryan, for introducing me. Good afternoon, everybody. This is my pleasure to be a part of this seminar. I'm Akinori Nakata at the International University of Health and Welfare, Japan. The title of my today's talk is Sleep, Work, and Health. There's no COI for me. Before moving into my presentation, I have listed here my research areas. Dr. Ryan just explains a couple of my research areas. And if you're interested in my research, please let me know. But today I will talk about the occupational sleep epidemiology studies and psychosocial work factors and biomarkers. First one is occupational sleep epidemiology. Well, I will talk about the background first, and maybe some of you are not familiar with what is a social jet lag. This is relatively a new concept, and I'll briefly explain what is social jet lag and a sample example study based on a large epidemiologist study by myself. So I think many of you remember about the catastrophic disasters happened in the US. The causes of these disasters are multifactorial, but work-related fatigue or sleep deprivation have been blamed to be one of the strong causal factors. Even though we have experienced these disasters, we still are continuing to experience these. An important question is, have we learned enough from these lessons? The answer is not enough. I will compare the Americans and Japanese workers, how it's going on with sleep issues. And you see the left-hand side is based on the National Health Interview Survey during the 2010 to 2018. It looks at the prevalence of short sleep duration, less than 7 hours a day in working Americans. You see that there's a small increase every year that during the 8 years, a 4.7% of increase in short sleep, that more than 1/3 of American workers are having short sleep. And right-hand side, you see that in Japanese government does the time use survey for every 5 years since 1976. And you see the sleep duration and for men and women here. And you see that on weekdays, Japanese men and women are sleeping less every year and every 5 years. And Saturdays, in until 1986, Japanese are working on Saturdays as well. So that follows the same pattern with weekdays. But after that, they sleep a little bit more on Saturdays, and in Sundays, we sleep a lot. So this slide shows you the difference between men and women. Women are sleeping less than men. So what is common is that we have problem with sleep duration in Americans and Japanese workers. And here's a slide showing the cost of sleep deprivation by country, that the United States are losing a lot of money by insufficient sleep, like $411 billion per year. And Japan follows that. We lose like $139 million per year. And so as Germany, UK, and Canada, they lose lesser, but sleep deprivation is a big problem with United States and Japan. So how do we compensate for short sleep? And what we do is that we sleep more on weekends, non-work days, and this is called weekend catch-up sleep, that we try to sleep more on weekends, on non-work days. But this creates sleep debt and social jet lag, because we need more sleep on weekdays, on working days, but we can't, and then we will put them into the non-work days. So these are creating problems. So I'm going to explain a little bit about the social jet lag. Here's the what is social jet lag? The social jet lag is defined as sleep timing discrepancy between work and free days, between social and biological time. In other words, the misalignment between the internal clock and socially required timing of activities. So this concept was first built by Ronenberg. He is a German scientist. And if you want to look at the details on this topic, you can go through this paper. So what we do is that this is an example of how workers compensate for short sleep. Upper part is person A, and this person is sleeping 6 hours on weekdays and sleeping 8 hours on weekends. This is, as I explained, is called weekend catch-up sleep. These people are paying their sleep debt on weekends, like 2 hours here. And the problem with the person B, you see that he or she is sleeping same hours on work days and non-work days, but there is a phase gap between the work days and work days. This creates social jet lag. So he is experiencing a sort of small jet lag every weekend. So for that, if that continues, it will create a lot of problem in the future. So how we calculate social jet lag? Here's an example, same as the previous slide, that on work days, people are sleeping, the person B is sleeping 12 to 1, and we use midpoint of sleep, which is midpoint is 3 a.m. You see that 12 and 6 is midpoint at 3 o'clock. And also for the non-work days, this person B will go to sleep a little bit later than work days. He's enjoying his time and weekends, and then wake up a little bit late like in the 9 in the morning. So mid-morning sleep is 5 o'clock, 5 a.m. So you subtract the 5 a.m. from 3 a.m. 3 a.m. from 5 a.m. So that will you have 2 hours difference. That is how we calculate the social jet lag. And it is well known that more than 2 hours difference will make you health issues in the future. And this is a Fitbit study of 6 billion nights of social jet lag that in the US by cities. You see that Boston is highest, which is 38.7 minutes. And the close city, Seattle, is in it's like 33 minutes. And Las Vegas is smallest. There's a difference in cities. And you can see that why the Boston is highest is probably by the explanation of the by the website here that there's a young people living in it's a university town, and people may be busy. That the reason they have social jet lag most. And the in one of my studies, I have focused on social jet lag and suicidal ideation. And the reason I focused on the suicidal ideation, I will explain it, but I will show you the backgrounds and the study population of my study and research questions, findings, as listed here. And I'm continuing these studies even now. So some of you may know about karoshi. Karoshi is death due to overwork. Japanese people tend to, well, we are forced to overwork, and there are people die because of too much work. And suicidal ideation is connected to that. You see that there's a number from this slide shows you that from 2000 that we had a large number of people dying with the death by stroke, heart failure due to overwork. And this number is gradually decreasing, but the blue line is showing you that suicide due to overwork. So the karoshi is consist of 2 parts. One is by physical problem, and another is by mental health problem. And the big issue now is that we have suicide due to overwork is increasing here, especially among younger employees. So this is becoming a big problem. So it is important to prevent suicide due to overwork for younger people. I conducted a large-scale study involving more than 100,000 workers from all over Japan. And this is not a representative sample, but I have collected data from public administration for 40%, which is oversampled, and manufacturing 33%. So but it was very good for me to do this study from all over Japan, that we had more than 100,000 participants. So in the question, we asked about the suicidal ideation by a single item question, asking, I seriously consider that I would feel better if I were to die. This is asked during the past 2 weeks. There's 4 options: never or almost never, a little occasionally, often or fairly often, very often, always, are considered to be having suicidal ideation. That was 3.8% among the total population. And with the statistical analysis, we have done multivariable logistic regression to estimate the risk of suicidal ideation by social jet lag, controlling for multiple confounding factors as listed here. We especially paid attention on the lifestyle factors as well as sleep deprivation, insomnia symptoms, and also other job factors like job control, job demands, and social support, and also work hours, as well as survey season and also the industry sectors as well. And in case to trying to look more into the people with day workers, we excluded shift workers and people with major mental issues like depression, panic disorders, eating disorders, and also CVD and cancer, which may affect sleep. So we used this criteria and did an analysis. So as we expected, the distribution of social jet lag by age was higher in the younger workers. So you see that people aged 18 to 25 years, nearly 40% had social jet lag with 2+ hours, and 26 years old to 30 years old, like 27%, and gradually decreasing after 30 years old. And you see that with old people, they're only like 3 to 4%. So the issue is that in social jet lag studies, we should focus on younger people, looking at the effect of social jet lag on various health issues. And this slide shows the social jet lag category. You see that left-hand side, it's less than 1 hour is considered as the control group, and 1 to 2 hours, 2 to 3 hours, and 3 hours. You see that the issue, the effect of social jet lag is clear after 2 hours. There was a 23% increase in 2 to 3 hours, and when it's more than 3 hours, it jumps up to 1.89. So this is in the total population, but when we group these into younger workers and older workers, you see a difference. The blue ones are less than 40 years. You see the same pattern with the total population in 1 to 2 hours. It's a little bit decreased, but 2 hours to 3 hours, you see like 1.24 for younger workers, and for the people with 40 years or older, it's like the same, but there's a difference more than 3 hours. You see that with people with 3 hours and more, it jumps up to 2.12, but for the older workers, it's 0.61. I haven't, I don't know the reason, but probably for people with 3 hours or more is like social jet lag survivors, so that they're people who are adapting very well. That may be the reason. So there is, I think, when you know about the why people, well, there's a Blue Monday. It's a term called Blue Monday. That why people feel Blue Monday or Mondays. Social jet lag may be the one of that explanation why people are feeling that, and it is well known that in various countries, suicides are highest on Mondays. That may be because they have a problem with their sleep phase difference, a social jet lag and may have meant feeling not well on Mondays going to work. So with my studies, I had looked into the social jet lag and various health and safety outcomes. The one that I explained with is suicidal ideation, but I found the relationship between social jet lag and increased work-related fatigue, and also MSDs, as well as poor work engagement, and also increased occupational injuries and poor eating behaviors like skipping breakfast and eating late at night or eating snacks more frequently. So these are the issues that are related to social jet lag. And here's a question for you that how many of you have dogs as your family member? And not a cat, it's a dog. So I was hoping if there's timing that we have raised hands, but the reason I'm asking you is that the dogs, there's a synchronization of owner and the dog's social jet lag that if the owner has a bi-social jet lag, their dogs are affected by the sleep pattern of the owner. So that could be affecting the dog's health. This is important because the sleep pattern is not only about oneself, it's about your family as well. That makes you that um, even affecting dogs, meaning that affecting your wife or husband, affecting your kids, affecting your other family as well, so that social jet lag is a societal problem uh, in many industrialized countries. So the conclusion and implication is listed here. So the younger workers seem to suffer more from social jet lag, and the association of social jet lag with poor mental health is strong among them. The second is that the social jet lag research can help workers to develop self-awareness of their sleep pattern and as implication to promote workers' health. And in my study, I have shown that social jet lag research may also improve workplace productivity and safety. And from the finding from the dog study that social jet lag could also affect workers' family as well. So these are the importance of doing research on social jet lag as well as preventing social jet lag. And here's the my ongoing intervention research. As you are aware that our sleeping pattern differ by not only on weekdays and weekends. We have different patterns in every day. So using the wearable sleep trackers and following these sleep patterns of not only the workers but their family as well, we are trying to do that. This is ongoing study. And what we do is that in Japan, we have annual health exam, which we get all these data on self-report data and biological data such as HDL, LDL, and all these biomarkers, as well as we get the blood from these people, and we're asking for CRPs and cytokines and neocortisols and these data as well. And we trying to gather them as well with the wearable sleep trackers data. And what we are doing now, I have the big data set, and trying to develop an easy and feasible approach for workers to do to minimize the social jet lag. Here's an example that the sleep debt, it's we can see that the sleep duration, sleep timing is all set at the same time. You sleep at 12 in weekdays and non-work days. But this pattern may be easier for the workers to do is to maintain the same midpoint of sleep by sleeping 1 hour earlier and 1 hour waking up 1 hour later if they need to sleep more. This is a way that I'm thinking to minimize the social jet lag. And in our data, it was shown that if you sleep in this pattern, the fatigue, work-related fatigue is reduced by this way. So we are still in a preliminary phase, but maybe this is one of the easy way for workers to do in their daily life. So I have finished the first part, and I would like to accept a couple of questions, 1 or 2 questions to any for clarification.
So everyone, feel welcome to post questions in the chat or raise your hand, and Justin and I will try and spot you. I do have a quick question. Would another potential sleep or schedule solution be changing your work schedule during the work week, where you stay up later and so your sleep time is the same through the work week and the weekend? If you are kind of a younger person who's a night owl on the weekends, that you shift your work schedule during the week to the same one.
Mm-hmm. Yeah. So yeah, it's and recently the people are not going to office and they're remote work, and so they can control better, I think, with the sleep hours. Yes.
Hi, we have a question from Erin Flynn. The question here is, what is the general understanding of why people are sleeping less? Is it because they are working more or other reasons?
Yeah, main well, in the Japanese context, we have people are working long work hours. We work very long, and because it's a traditional Japanese working style that we work a lot, and that is you receive a good evaluation by working long hours. So this is, but in like 1970s, so many Japanese people worked long hours. They are working on Saturdays as well, and then we succeeded very well. Our economy jumped up. But nowadays, even if we work a lot, we don't get so much money, and but we still have that kind of tradition for working long work hours is good, which is an issue. Yes, I think in the United States as well that people are working more than the past, and if you work more, you get more money, and you earn more money, but you will have health issues in the future. So that's what I think the people working long especially in the Asian countries. Korea does that same thing. I think China does the same thing. It's a kind of Asian tradition that they work long. Okay.
Looks like we're good to go.
Yeah. Okay, thank you very much. The second study is the psychosocial work factors and biomarkers. The I have paid attention on the psychosocial job stress and biomarkers, especially on the immune markers. And I have done uh, studies on that, and I would like to suggest some uh, immune markers that are suitable for occupational epidemiology, and 3 examples for my research. First one is like I will focus on the social support. Um, there are a lot of studies about social support, and the first one is about the receiving social support. The second one is providing social support to other people. And third one is nail cortisol as a non-invasive biomarker of psychosocial work factors. As usual, I will show the comparison between Japan and US, that in the US General Social Survey during 2002 to 2018, you see that people with high stress always, plus often, is more than 1/3 of American workers. And in Japan, we have like close to 60% of Japanese workers suffering from high job stress. So these are the both issues in both countries. And my research framework is that if you're exposed to excessive job stress, could result in physical mental disorders through disruption of our systems such as immune, nervous, and endocrine system. So the immune system is thought to be the major defense system of the body and is directly related to development of infectious disease, allergy, cancers, CVDs. So I looked at in that to find out the mechanism of how the work stress are affecting our body. So the many studies are looking at the direct effect of job stress and long work hours and low social support, high work effort reward imbalance against stroke, CVD, diabetes, hypertension, depression, MSDs. There are a lot of studies have done that, a lot of prospective studies, but what links these relationship is the immune hormonal responses. As you can see that I have focused on natural killer cells and also inflammatory markers such as IL-6 and CRPs. And also recently I'm focusing nail cortisols, which is I will explain later. With regard to the blood immune markers in the large sample research, it is important to consider reliable and suitable measuring system. I have evaluated blood immune markers using these devices. On the left-hand side, I used flow cytometer, and you can measure lymphocyte subsets like NK cells, T cells, B cells, and a lot of different markers as well. And you can measure them simultaneously with a small amount of blood. And recently, I've looking at the using the cytokine multiplex assays that in the past, it's you measure all these pro-inflammatory markers. It costs a lot, but recently they can measure it simultaneously, more accurately. So I have introduced this assay system in my lab. And I'm at the same time, I think it's reasonable to look into the non-invasive stress markers. So I'm currently using the nails to measure the cortisols. The study 1, perceived social support at work and inflammatory markers. And I think all of you know about this, but it is well known that social support is helpful in promoting and maintaining health of people. Social support increases health promoting behaviors such as getting better sleep, healthier diet or maintain smoking cessation. That is number one on the left. And secondly, social support works well when you are exposed to high stress, inducing CVD responses when exposed to high stress. And the third is that it is known to inhibit overreaction of inflammatory responses. So I have focused in this third part. And the important thing is that the source of social support. There are a lot of studies showing that the social support is good for your health and reduce your inflammatory markers or increase your cellular immune functioning. But the issue is that I wanted to clarify, who are you receiving from? For instance, if supervisors are helping you very well, or your coworkers help is important, or your family or friends. So I have differentiated this social support and look at the 5 different inflammatory markers. And in the findings of my study clearly indicated that there's 3 different types of social support, and one is social support for immediate supervisor, and this had significant impact on reducing IL-6, and social support from coworkers had a weaker effect on TNF, and we didn't find any association with social support from family and friends. So in the Japanese case, immediate supervisor social support is important in reducing the inflammatory markers listed here. And this study was replicated by other studies in Japan and other countries as well. The second topic is the other way around, that it's a lot of study is focused on how you perceived your stress, perceived your social support, but I have focused on providing social support to other people at your workplace. And what prompted me this is I noticed that there's an opposite side, that providing social support, a study by polling, we're looking at the stressful events and the mortality for 5 years. And as you can see that compared to low stress, high stress people die earlier. That was significant, 1.3 with relative risks. But in that survey, they asked about those who helped others, either with high stress or low, did not have a decrease of mortality 5 years later, which meaning that if you help people close to you, in this case, it's your relatives, helping relatives or someone close to you, that makes something difference in your survival. So that I was surprised with this paper and start looking on the social support and providing social support. I think Tsukumi has done some of these studies, but I've looked at providing social support attenuate inflammatory responses. This is we're doing a preliminary study on that, and we have done a prospective study with more than 1,000 men, and we found that it is weak, but if you are you think that you're supporting your boss, supervisors, your inflammatory marker IL-6 is reducing, which is something interesting that you're providing support to someone that helping your health. That's something that was interesting, and also the coworker helping providing social support to coworkers is also has some effect. So this was something interesting, and family friends, we didn't find anything there, but which tells us that receiving social support and providing social support to other people is something connected to improve your health. So here's a third study. I talked about the fingernail cortisol as a non-invasive biomarker for assessing work stress. This is the ongoing study, and we have looked at the effort-reward imbalance and the fingernail cortisol. And before I'm going to show you the results, I would like to explain a different types of non-invasive biomarkers for measuring cortisol, and my research framework and findings. And I think many of you know that cortisols are measured with saliva and hair. And more recently, fingernails are used for measuring the cortisols. And we are, my colleague Izawa is one of the first one who did that, and we are collaborating with him. And the difference between the saliva and fingernail hair is saliva is reflecting rather the acute stress response, but the fingernail hair is that it's looking at the chronic effect. So there are advantages and disadvantages here that you can see that they are for the fingernails that will reflect for a few months, and we don't have diurnal variation, which is not affected by like saliva, and you can keep it in room temperature for a long time. But there are confounders like who are using manicures, frequent washing hands, or nail destruction, and some hormonal disease like Addison's disease. Their cortisol are affected. And for the validity, the saliva has a lot of studies and high reliability. Fingernails are still in the way, so moderate to high, I think. And we only have limited findings here. So I think if we are successful in measuring fingernail cortisols, that is it is usable as a non-invasive marker. And here's the stability of fingernail cortisol. We measured time 1, which is the baseline, and we measure the same people in 4 months later, and there are the association is pretty high, that more than 0.5. So I think the fingernail cortisol are stable during the 4-month period. And for the questionnaires, we used the effort-reward imbalance model. It's a theoretical model for psychosocial work environment with adverse effects on health and well-being that focuses on the mismatch between high effort spent and low rewards received at work. So who makes a lot of effort but does not get reward will be a high stress. And here's the component scales of IRI. I think many of you are familiar with this. About effort is composed of like time pressure, pressure to work overtime, like that. And low reward is not only about the monetary gratification, but like respect and the future of your work, like job insecurity. So these are the how they calculate the effort reward imbalance. And here's the preliminary results that we had looking at the effort score, the correlation between effort score, reward score, and effort reward imbalance score with Kotzebue time 1, which was a baseline, and Kotzebue time 2. In this study, we have seen that there was a correlation that higher effort score is related to higher cortisol in the nail in both times, but the effect was stronger in the time 1, which is the cross-sectional data. But the when you collect the nails that at the baseline, that is the past cortisol measurement. So we try to match the timing, like questionnaire survey, and we collect the nail cortisol 4 months later, which is the which match with the timing with questionnaire and cortisol. So that's what we did, but the correlation was stronger with the cross-sectional data. So the conclusion is that perceived workplace social support has a negative impact on pro-inflammatory markers, which may relate to poor health in the future. And providing social support to others may have positive impact on inflammatory markers, which may prevent employees from developing stress-related disorders. And use of non-invasive biomarkers to evaluate chronic job stress could be applicable to workplaces, because it's more easier to collect than blood. The future directions is that assessing immune markers may help us understand the mechanisms of job stress, ill health relationship in occupational epidemiology. And second is identifying cost-effective and non-invasive biomarkers for stress-related disorders is particularly important to address the subjective bias resulting in the self-reporting measures. And then not only negative side of work, like high job stress, but promoting pro-social behaviors at the workplace may create safer and healthier workplace. That's what I think. And thank you very much for your attentions. I was a little bit quick, but I would like to accept questions. Yes. Thank you very much. Clapping.
Yes, thank you so much. Both Justin and I are monitoring the chat, but feel free to raise your hand if you want to just speak up and ask a question. I see a hand from Leslie.
Yes.
Yes.
Hi, Leslie.
Hi, Aki. Thank you so much.
Hey. Sure.
That was
Thanks
great.
very much.
Yeah, that was great. I would love to hear more about your experiences in the field collecting these inflammatory markers from workers, and how, and I don't know if you've been in the field or if you have research assistants in the field, but I think it's such a challenging issue. And so I'd love to hear a little bit more about how that has been for you.
Okay, great question. Yes. Well, what we do in Japan system is that we have like annual health exam for all workers. Every workers need to go through that exam. So we collect the data there, and then we asked, since they collect the data, collect the blood, like 5 to 7 milliliters, we asked them to participate if they can provide us the blood samples, but we don't collect additional blood samples. So that's easier for us to just asking them, oh, we want to look at your serum inflammatory markers, and we will feedback you what was your value to maintain your health. So that was the first idea, that easier for us to do the survey and collecting the blood samples. And then once you collect the serum, it's like if you put that in the fridge within 4 hours, that that will not change so much. After 4 hours, that will change, but you have to keep in mind that if after you draw the blood, we have to separate the serum within 4 hours. That was a difficult issue, but we did that. And in the annual health exams, we have like 200 to 300 people coming to the exams every day, so that we can keep in certain days, for instance, like 10 days for 2,000 people. So like that, in that way, we can collect the data in the same timing for all the workers there. And so in that way, we can collect a lot of data there and systematically collect the serum at the same time. Yes.
That's really, I don't think that we have an analogous program in the States to that degree. I mean,
Yeah.
unless, I mean, that's phenomenal. That's great that you've been able to do that, and that the systems are are set up in place.
Yeah.
Yeah. Great.
I
Thank you.
Thank
All
you.
right. Dr. Lloyd has the next question, and then after
Sure.
that, Dr. Mitchell has one in the chat.
Sure.
Thanks so much for a really fascinating talk.
Oh, thanks very much.
I'm really intrigued by the nail cortisol application, and I'm just wondering, in terms of the stability of the cortisol in the nail, that let's say you have someone who might let their nails grow to fairly long. If you were to take the distal, say, millimeter versus the, let's say, kind of do a gradient back to the developing nail, do you see a gradient in the levels of cortisol, or is it, in other words, you have to have a standard length of sample, say a millimeter, that would then give you the most current reflection of the stress levels? Thank you very much.
Yeah. Well, I'll first explain how we do it. For the nail cortisols, that we ask the participants to grow their nails for 2 weeks, and then they cut their nail for 1 millimeter, so that we can look at the same timing and same amount of cortisol. And the issue is that even if you ask about that, people may cut their nails more or less. So that's one issue. And we collect the data from 5 fingers, but the small finger, that the cortisol accumulates more than other fingers somehow. So what we're doing is collecting sample from 3 middle fingers, so that that may be stable. And also people having nail issues, that is what we found that is different values than the normal fingers, so fingernails. So we do exclude these people from the analysis, and those who have hormonal disease and Addison's disease and things like that with high cortisols, these are people that we need to be aware of. And that's how we do. And the other question you're asking is
No, that covered everything. Thank you very much.
Oh, okay. Thank you very much. Yes.
Hi, Dr. Nakata. I'm going to
Sure.
be reading Dr. Mitchell's comment.
Yeah.
Their comment was very interesting. Wondering if higher levels of social jet lag are associated with higher levels of ERI, and whether perceptions of ERI varies across the week. In parentheses, Blue Monday effect.
Yeah. And the question is let me just
The question was wondering if higher levels of social jet lag are associated with higher levels of ERI, and whether perceptions of ERI
okay.
varies across the week.
Oh yeah. The social jet lag is associated with the high job stress, the effort reward imbalance, and I think it may be a other way around as well, because high ERI, people with high stress may create social jet lag as well. So they have the correlation. We cannot tell which, well, they are associated, but it's like the people try to work a lot and work long work hours, and then that is effort, and then you have social jet lag, and then you're having social jet lag, and you have feeling of high stress that may create higher level of ERI as well. So that's I think uh, there's the root that is creating, like stress, sleep problems, and or health issues that goes around and around. So I think that yeah, that's what I think. Yes.
Thank you so much. This is Suzanne. I actually also wondered whether there was a variation in ERI across the week, partly driven as a way to get to partial out this positive feedback loop you're talking about.
Mm-hmm. Oh, you mean, okay, during the week, effort reward difference in the week. Okay, yes, I haven't looked at that. We the data are collected during the health exam, in particular timing, but I'm sorry I can't answer to that. But in our we in this case we look at the blue collar workers. So they are making clothes, and so I don't think they are in the week. There may be not much difference, but they're in the monthly. If they have to make the school uniforms, they have heavy duty during the end of the fiscal year, because the new fiscal year they need to get a new school uniform. So we have seen that, but yes, I just remembering that the effort reward imbalance was effective in the not busy season, because the reason with that is that people with the if it's non-busy season, there are people working very hard, not working very hard. There's variation there. But if you're at the busy season, everyone is working so hard, you cannot see statistically the effect of effort reward imbalance on male cortisols. That was our finding. Yes.
All right. Well, we're just about at time. And so thank you, everyone who had questions. And thank you, Dr. Nakata, for this wonderful talk. Maybe a last round of virtual applause. And thank you for posting your contact information. Please follow up with Aki directly if you have
Yeah.
follow-up.
Please let me know. Yes.
I also want to mention, Dr. Nakati joined us all the way from Tokyo, all the way at 4 o'clock in the morning. So really appreciate you joining us that. And And
I'm glad
also-
that I'm not sleeping. So yes, but I'm so glad to join this seminar, and I hope we can have collaborate work in the future. And please email me if you have any further questions. And thanks, Emily, for inviting me. I'm so glad to join this seminar. And Dr. Ryan, thanks very much for your help.
Thank you, Ryan, for facilitating this seminar. Appreciate it. And then also, I'm happy to. I'm so glad to see we have other OHP colleagues, like like Dr. Stephanie Pai from University of Texas joining us today. So there are other OHP colleagues joining our seminars, and again, very glad to see that, and again, to share with the communities about what you do.
Yeah. Thank you very much.
Thank you,
Okay,
Aki. Thank you for, yes, again, talking about social jet lag and sleep. I was thinking about you
I'm
doing
getting
this.
to sleep, yes. Thanks, Leslie, and yeah, thanks for your question. And I am very glad that yes, there's so much common in your institute and my self-study. So I think it was very helpful for my study as well. Yes.
Great. Take care. Thank you.
Okay.
Everybody,
Thank you very much.
everyone. Thank you, Ryan.
Bye.
Thank you,
Bye.
Bye.
Yeah, bye.